Chapter 12, Specimen Handling, Transportation, and Processing. As phlebotomists, this is also part of our responsibility to process specimens and make sure that they are transported to the lab in an appropriate time frame. Again, these are just the chapter objectives that are covered in this chapter. Specimen handling, again, we're going to go back to that pre-examination, examination, and post-examination process. Remember the phases in the laboratory cycle. The one thing that I want to reiterate is that as phlebotomists, we are in that pre-examination process, which also includes not only collecting the specimen, but also transporting the specimen, specimen receipt, handling, and storage, and also to processing the specimen in certain circumstances. Preanalytical examination variables, patient variables. We had talked about this previously when we looked at Chapter 9, identity, age, gender, pregnancy, meds, fasting, non-fasting, refusal to cooperate, patient's absence, stress and anxiety are some of the patient variables we might experience. Transportation and handling variables vary. Precise filling, mixing, tube leakage, and breakage could potentially happen. The other thing that we need to be aware of is we're looking at patient variables. This is going to change how we're going to be able to draw the patient or not draw the patient. Please remember documentation is essential in the circumstance where a patient were to refuse a blood draw. Specimen processing and storage variables, centrifugation, processing delays, contamination of specimen, and exposure to heat or light. There are some tests that require a specific protection from light, otherwise the specimen starts to be exposed and starts breaking down. Processing delays, we forgot to centrifuge the specimen. The specimen didn't get transported at the proper temperature. Contamination of the specimen, an example of this would be we touch a venipuncture site after we cleaned it, and therefore now we have contaminants in that specimen. Specimen variables, hemolysis, again that's the breaking apart of red blood cells. Blood volume in the tube is too little or too much. Mixing of the additives, you forgot to mix the tube in general. We're going to mix the specimen. It's going to be a gentle 5 to 8 inversions, even distribution of additives. We're going to avoid clots, incomplete clotting, or hemolysis. We're going to label our specimen correctly. You're going to label the tube after the blood collection within the patient's site. All required information, name, ID, number, date, time, and of collection, name of the healthcare worker, just to name a few. Place label in the correct orientation, and it's going to be on the pre-existing label, and I will show you this in class. This is again just how we properly align. Okay, we want it going in this orientation. These are some examples here of ways we don't want to label our test tube, because if we were to label the tube this way, the label could potentially come off. Labeling the specimen correctly, care should be taken to lining up the label on the tube. Sign or initial the label and confirm that the label sample is correct and belongs to that patient. This is shown here by the technician having the patient ID the sample before they leave the draw chair. Place the specimen in leak-proof plastic biohazard bag. The transportation bag may have a pouch on the outside for laboratory requests. Please place that in the designated spot, because if possible, if we were to put the requisition inside with the specimen and there was leakage, now the requisition's ruined as well. If possible, maintain tubes in vertical position to promote complete clot formation, reducing risk of hemolysis. Especially important when we're looking at our serum tubes that need 1 hour to clot. 30 to 60 minutes. Handle blood specimens gently, and please always wear gloves. This is just some examples of some specimen bags. Transport of samples should occur as soon as possible without delay. Specimen handling is needed for specific laboratory tests. There are CLSI recommendations. Please reference Table 12/1. This is what's called thermiable, which means that the substance is sensitive to high temperatures, and the specimen being tested for these substances need to be chilled immediately. Chilling a specimen inhibits blood cell metabolism and stabilizes most constitutes. Please be aware we do not want to use large chunks of ice. We're going to do what's called an icy slurry, which is a mixture of ice and water. Special note for blood gas specimens, we don't need to know this in its entirety because we do not collect these, but some analytes are negatively affected by chilling, such as potassium. So if a potassium test is ordered and collected in the same tube with other analytes that require chilling, it should be tested within 2 hours. Please be aware these are some of the common lab tests that require us to have chilling mechanism in place. Ammonia is the most common one. Lactic acid is another one. Gastrin is another one that I've commonly seen. Again, table 12/1, we're going to look at specimens that require transport at 37C. These require a specially commercial heat block to keep the specimen warm. Cold agglutinin, cryofibrinogen, and cryoglobulins are some examples of some common tests that need to be kept warm. Then we also have photosensitive, which is another special handling requirement. It means a substance is sensitive to light and will decompose after exposure to bright light. Our common tests for this are bilirubin, a lot of our vitamin levels, vitamin A, vitamin B6, and folate. Blood collected for light-sensitive chemical analysis should be protected from bright light with a commercially available amber-brown biohazard bag or tube, an aluminum foil wrapping around the tube, or transport container that does not allow light to enter. Recent studies have suggested that exposure to light may not affect folate and B vitamins, so some facilities don't have this in place, but definitely the bilirubins, we draw these for infants that have jaundice-like appearance when they're born. I'm going to have you review this on your own. This is just going over plasma-based coagulation analysis. Some of these require that we separate the plasma from the cells within up to 24 hours, and also be aware that coagulation specimens may be rejected if they are clotted, underfilled, or overfilled. This is some chilling specimen blocks we might have. This is an example of the icy slurry I was talking about and wrapping the tube in aluminum foil to protect it from light. Microbiological specimens transport immediately to labs so the specimen can be transferred to culture media or analyzed. Blood cultures are usually collected directly into culture media, but still need to be transported quickly so that culture media can be incubated to promote growth of bacteria, and this would be those blood culture vials that I have talked about. There's an aerobic and anaerobic version. They're used to detect septicemia. Specimen transportation from remote sites. Please be aware that there might be special guidelines and precautions, and we use an enclosed or lockable container to avoid spills in the automobile. Please review this slide on your own. This is some transportation containers for longer distance. As you can see here, there's foam blocks in these to prevent the tubes from breaking. Specimen delivery methods. There's hand delivery and the pneumatic tube systems. Pneumatic tube systems have a shock absorbent padding liner, tubes and biohazard bags. We do not want to overload or transport glass because if the specimen were to be lost or broken, it could ruin the tube system. So we will hand deliver microbiology blood cultures to lab, and we can transport via automated carrier. This is what the pneumatic tube system looks like. CLSI recommends guidelines for handling and processing. Some specimens do not require centrifugation. Some hematology and coagulation require whole blood. Need gentle mixing using a mixing tray. For hematology and coagulation test specimens, we're going to test them as soon as possible. Pre-centrifugation, we're going to follow procedure policy for your facility. Rule of thumb, remove plasma or serum from cells as soon as possible or no more than 2 hours after collection. Again, pre-centrifugation, plasma specimens centrifuge. We can centrifuge immediately. Specimens without anticoagulant additives must clot 30 to 60 minutes prior to centrifugation. Clotting time can be delayed by a patient who's on anticoagulants. And chilling the specimen will delay clotting. The specimen may take longer to clot, especially if it is chilled. The other thing to be aware of for clotting time may be delayed by patients with anticoagulant medications. This is common with Coumadin and warfarin. Clotting may be accelerated by activators such as glass or silica particles, and also snake venom. We're going to keep photosensitive analytes wrapped in foil or placed in an amber specimen container. Centrifugation serum samples should clot before centrifuging, and complete clotting takes 30 to 60 minutes. Leave the tube caps on during centrifugation. We're going to balance the centrifuge, which I'll show you this in class, and do not open the top of the centrifuge until it's stopped completely. We're not going to centrifuge a specimen more than once, and we're going to follow manufacturer's directions for use of gel and non-gel devices. There are temperature-controlled centrifuges for those frozen specimens and specimens that need to be kept warm. This is an example of a centrifuge that's balanced. The tubes balance across from each other. This would be an example of an unbalanced centrifuge because there is not a tube directly across to balance it out. Post-centrifugation, remember to separate serum or plasma from cells in a timely manner. Refrigerate or freeze specimens accordingly. Specimens may be divided into numerous aliquot tubes, and I will show you this in class. Post-centrifugation, we do not freeze, thaw, or refreeze specimens, and serum plasma be left in contact with gel barrier, separator device, or plunger. We're going to inspect tubes after centrifugation to determine that the tube is appropriate. We're also going to look for hemolysis. We're going to store tubes in upright position with secure closure. Excessive aggregation may cause hemolysis of our specimen, and specimens may appear lipemic, which is that milky, cloudy appearance of the serum or plasma. And this is, again, A is that lipemic, B is going to be hemolysis, C is a tube to where we could see that the plasma is separated, and then this is an example of a full whole blood tube. These are just some commercially available plungers. I'm going to have you review these next couple slides on your own. Reporting laboratory results, written or hard copy, must be confirmed, dated, and accompanied by permanent reports available in the laboratory and in patient's medical records. Must contain ID of the patient, location, and physician, date and time of specimen collection, and time of completion. We're also going to include descriptions, source of the sample, or any precautions. The other thing is it needs to provide reference ranges for those test results. For verbal reports, useful to report stat results and critical values, but are more prone to error. This requires that the laboratory staff call a doctor or nurse and must be authorized to report confidential results. The documentation should include the patient name, ID number, person receiving the report, date, time, information given, and person issuing the report. I'm going to go over this in detail in class. Electronic reports are more reliable, fewer errors, but computers conveniently located in the hospital and clinic, they provide quicker turnaround time. Results displayed immediately, so that way we can start treating the patients sooner. Privacy and confidentiality are maintained. This is protected by passwords and access for certain employees. Computerized reports are controlled access, and they're also regulated compliance. So the thing that we got to be aware of is computerized reports. We control the access of who sees them and who receives them, and they're also within compliance to the patient's rights and HIPAA. That concludes Chapter 12. I will be covering this in detail in class, especially the photosensitive, thermoable, and specimens that need to be warmed. I also will cover verbal reports as well in class.